Welcome to the DLC 4th birthday party. So we're going to be running with really exciting presentations all day, and thank you for joining us. I'm actually going to start out with talking about one of our favorite product lines, SkinBetter Science. And we have our product expert here with us, the SkinBetter product expert with us, Kirsten. Thank you so much for coming, Kirsten.
Thank you so much for having me.
Oh, it's such a pleasure. One of my favorite products to recommend for patients when they're really just kind of dipping their toe into facial rejuvenation and improving the overall skin quality is the SkinBetter Alpha Red. And a lot of people are like, well, Alpha Red, what does that even mean, right? Don't you hear that a lot?
I do.
Yeah. So Alpha Red is actually a retinoid, but it's a retinol technically. So if you've ever heard of Brithday and you get a little bit nervous, like, oh, that always burns my skin or makes me peel, well, you are in luck because Alpha Red has all the potency of a prescription, but it has the tolerability of something a lot milder. And it's what it is a retinoid conjugated with glycolic acid, so it carries that gentle retinol into the skin deeper to really have fantastic effects. Do you have any more to add, Kirsten?
So it also has the lactic acid in it, and that lactic acid is just amazing for our skin because it's a very hydrating acid. So that, on top of everything else, obviously helps with having that, no irritation.
That's right. I think a lot of people are always fascinated, like an acid that's hydrating, how is that possible? But really that acid binds water and carries it into your skin, and that also improves the tolerability of the product. Another one of my favorites, as you know, Kirsten, is the Alto Defense. Why don't you share some big news about Alto?
Alto is absolutely amazing, and obviously the experts agree. We literally received the Allure Breakthrough Technology Award for that product when we launched it in 2017. For its unique technology, and we actually literally 2 days ago were told that we received the Allure Best in Beauty Allure Award. So this is the second award, and this is like the most coveted award in our industry. It's like the Oscars in our industry for our amazing antioxidant.
That's right.
And what makes Alto so amazing is the fact that it's not just a vitamin C, it's not just a vitamin E, it is a potent blend of 19 different antioxidants, 19 superfoods, and on top of the number 19, what really matters most is the solubility of those antioxidants. They're water soluble, they're lipid soluble, and enzymatic. So they literally protect the entire cell.
That's right. So Alto is, exactly, you can use Alto at night, you can use Alto in the morning, use it at night, it will carry through and protect you the next day. You can use it in the morning under your sunscreen because there's more than just UV rays that cause oxidation, otherwise known as free radical damage in the skin that causes that premature aging. So yes,
and it also protects you from blue light.
Yes, and we also have a great sunscreen that's all skin tone friendly and totally all mineral, the sunscreen stick. So we really do love the SkinBetter products. Kirsten, thank you so much for coming and telling us a little bit more about these fantastic products. And stay tuned because there is a SkinBetter raffle that we'll be talking more about soon. So Leanne is here about the specials today and maybe a little sneak peek about that SkinBetter raffle.
Hello, and welcome to the Dermatology and Laser Center 4th birthday celebration. I just want to echo Dr. Adigun when I say thank you so much to our community for all the support that you've given us. We are so thankful and grateful to be here at the veranda celebrating our 4th year in business. To celebrate our birthday, we have some incredible specials, okay? With the purchase of the event voucher, you guarantee yourself 10% off any treatment package or 20% off any single treatment. Now, that means 20% off Botox, 20% off laser hair, 20% off chemical peels, 20% off halo. So all of our treatments that we offer are included in that 20% off single treatment special. So how do you purchase this special discount? By calling us at 919-942-2922, you're able to purchase over the phone the event voucher, and that guarantees you the specials until November 13th. So we have lots of time for you to get your treatment in. Now, if you're purchasing a package of treatments, let's say you want to do 3 BBL photofacials, you just have to start that package before November 13th. That's the same for microneedling, that's the same for our Genius Skin Tightening device. Any package of treatments just has to be started before November 13th for your first treatment. Also, we are offering 20% off all products. Now, the reason you want to stock up on your sunscreen now or try a new product is because every product you purchase is an entry into one of our 5 incredible raffles that we have that we'll be talking more about. So, if you're getting ready for that laser treatment and you need your Elastin Skin Nectar, my favorite pre and post procedure product, you definitely want to stock up now because you get 20% off and you get an entry into one of our 5 amazing raffles, including the SkinBetter raffle. Now, that SkinBetter raffle, it has a really good eye cream in there. It's great for people who have, fine lines they want to address, bags they want to depuff. I've used that eye cream myself. I really like it. It also has the anti-aging product lines in it, which is a great topical treatment if you're not ready quite yet for filler, but you do want some plumping effect. And the sunscreen stick, okay, that's great for anyone. Good for kids. You can keep it in your purse. It goes on white, but rubs in clear. And so I am so excited to offer you all of these specials and all these exciting raffles that we have. DLC is just so grateful for your community support, and I know the COVID-19 pandemic has really thrown a wrench in all of our lives, but we're excited to celebrate with you year 4, and we're here for you if there's anything you need. Now, I'm going to head over to Dr. Adigun with facial volume replacement with the Restylane family of fillers. Fun fact, Restylane was the original hyaluronic acid filler that was on the market. Take it away, Dr. Adigun.
Well, hello, welcome. Yes, we are back here about to showcase what we can do with fillers. So I'm gonna adjust my goggles. I was having a goggle fog, but we have Kim here. Kim has actually been treated with fillers in the past. I did her fillers actually just 1 year ago. And this is what's so great about filler is that it actually has good staying power. And people ask all the time, well, how long does filler last? Well, technically, we know how long they last as far as how long it takes for them to dissolve, but they have really long-lasting benefits, which can be really remarkable in the sense that your body will actually remodel around the filler, so you get effects from the filler. Excuse me, I'm having a little bit of a earring situation. Long-lasting effects from the filler, even long after it has dissolved. So I'm just going to get my mask just right before I get started on Kim, because I'm having a little earring here. Andrea, how'd I do?
Yes.
I did it. Okay, perfect. And we're going to talk about Kim. Kim, I actually am going to have you take a look right at the camera here. And as you can see, really the key parts of the face that we need to restore in Kim, will you pass me some Q-tips actually, are in her mid-face area. She's actually still had nice filler maintenance right through here, which is usually the first area that we need to restore. And most women and men is that mid-face area. But I do need to support her cheekbones. And one of the ways that you can kind of tell is at time, do we need to go ahead and do those cheekbones, is you look down here. Is she getting any kind of fullness in this area? And she is getting some fullness in this area. And by restoring where she's had volume loss up here, it will improve that jawline. So it's interesting because people will come in and they're pointing to the problem, but the solution is in a different place. I'm also going to restore her lips, right? She does not have a big mouth. She's probably never had big lips, which means she should never have big lips. You never want to look like you have someone else's lips stuck to your face. So I'm going to restore her lips. We lose about 50% of our lips over the course of our lifetime. And so the best way to do it is to maintain them over time. Okay, and so I'll be doing a small amount in her lip using something called Restylane Kiss. We've been very excited about Restylane Kiss because it really integrates well into the lip tissue. People do not know that they have it. They feel like it's their own lip. It doesn't feel like there's filler in there. And it has incredible staying power. Historically, the fillers that we felt to be safest in the lips really wouldn't last very long, only about 6 months. But Kiss lasts for about a year. So it's been a really exciting filler to use because it's elastic enough to be very natural in the tissue, but then still also have that staying power. So it's really kind of having the best of both worlds. So I'm going to start by just going ahead and restoring her mid-face. We could also do a little bit in Kim's chin if we have time. But we'll start up here and then we'll go to her lip. Okay? All right, so can I have some gloves, please, Andrea? Yes, I love the pink gloves. Everyone knows that I love the pink gloves. Okay, so I'm going to start with Restylane Define. Restylane Define is also a very versatile filler in the Restylane family of fillers. One of the characteristics that makes Restylane Define so versatile is how elastic it is. It does not give you a big puff. Instead, it is more about contour and movement, right? So our faces are not immobile objects, right? They're constantly moving. And so we need our fillers to move as well. We need them to move with our skin. Okay. So rest your head back against that pillow for me, Kim. Perfect. So you're going to see I'm actually pulling her tissue. I'm going to lower you down. I got a little bit excited and raised you up really high, I think. There you go. And really kind of pull her tissue right where I want it. Little stick here. She's been numbing for about 30 minutes with a topical numb gel. So it really, really, really makes the needle sticks not as, what's the word I should use? Noticeable. Another little stick here. Sometimes I use something called a cannula when I'm doing filler. I actually use them quite a lot. A cannula is a type of tube. So a lot of times I can minimize the number of sticks needed. When I'm doing this lift in this lateral area of her face though, I do find I like the way a needle can perform in that area. So I'm just putting little sticks in this little tiny depots of product in the lateral aspect of her face, right along her cheekbones. And then you'll see I'm kind of pushing on her a little bit. Really what I'm doing is molding the product into place and pulling her skin up to where we want it to be in a non-surgical fashion, right? That looks great. I'm gonna come one more time right on this side, and then I'll switch to the other side. A lot of times I will choose Define when I'm needing to use a product in more than one area of the face. If someone just needs a small amount of filler, I can use Define safely in multiple areas of the face. So now you can see that we've restored that cheekbone. I'm going to come around to the other side. Okay, now rest your head back against that pillow for me. Perfect. So similarly, on this side, you can see me pulling that tissue, lifting that tissue up. Stick here.
We don't feel anything.
So Kim just said she really doesn't feel anything, and I think that is a really it's a testament to the numb. The numb gel really makes a massive difference. And there's actually lidocaine, which is a type of anesthetic in the product itself. So as we go along in the treatment, you actually become numb over the course of the treatment. And so I've really only used about 1/4 of a syringe on either side of her face. Once again, once you have full volume correction like we did for Kim a year ago, maintenance is easy. It doesn't take a lot of product to maintain her. We always want you to look just like you. So once we've corrected your volume deficit, that happens as a normal part of aging. Again, over the course of your life, you lose subcutaneous fat, your skin gets thinner, and you actually lose bone. And so bone is that's kind of like, those are our coat hangers. That's what holds us all up. But once we correct that, then it just takes a small amount over time. I'm going to come around to the other side again. I'm going to do a small amount in Kim's chin. I'm just changing my needle. Again, sometimes I do use that cannula, which is that little tube. We're not going to do that right now, but it is a wonderful tool. And if we do have time later today, maybe I will show you, because I use a little tube to be able to restore any kind of volume loss under the eye. So you can see she's starting to get a little bit of a notch here. We do lose our chin over the course of our lifetime, and the bone actually resorbs. And I'll be spending some more time on chin restoration later today, as far as chin projection and contour. I'm going to adjust what's called her pre-gel sulcus, which is this little area that starts to get deeper and causes that little notch. So right now you'll feel another little stick right here as I restore her chin from a lateral aspect. Again, using just a small amount of product can really go a long way. Sometimes it's kind of fun when trying to figure out, like, how far can we make this one syringe go? It's kind of like when you make a fabulous dinner and you haven't gone grocery shopping. Like, I just did that. I made this amazing dinner with all that I had in the house. Well, we're going a long way with just one syringe. Now that will stick right here. I'll come to the other side, and then we're going to do a little bit in her lip. Now, I will say, full disclosure, Kim was a little hesitant about me treating her lips. And I think that I think that's always like a great conversation. If you know me at all as your doctor, you know that I like us to be on the same team, and your concerns are always my top priority. Of course, I will guide you when I think, okay, well, maybe we need to start here. I will kind of guide you, but we're a team.
Yes.
Okay.
I'm actually excited.
Okay, good. See, that means that's
I'm
all.
excited.
She's excited. That's great. Again, we'll be using that Restylane Kiss. Another major benefit to Restylane Kiss is that it does not swell. Even if you have had lip filler before and you remember having a swelling period, it can be pretty distressing. Well, we don't really have hardly any swelling at all with Kiss. You have a little bit, but it's very, very minimal. Again, just smoothing out her chin here. For a lot of people, this is the first thing that they notice. They're like, thank you so much. I never even knew I needed filler in my chin. And now I'm just going to mold it down right here. Smooth out her jawline. Perfect. That's just one syringe of Define to restore, again, her cheekbones, her contour, and her chin area. One syringe. I'm going to move on to her lips. Okay. So when I'm doing lip filler, I like to use the smallest needle possible for several reasons. Number one, you never need to put any large volume of filler in a lip at any one time. The lip really, even if you are trying to actually increase the volume of your lip, you shouldn't put a whole lot of filler in any one place. And so by using a tiny little needle and a tiny little syringe, you can actually use just a small amount at a time, and it also really mitigates any kind of discomfort because the needle is so tiny. So if you can see this structure in her lateral, that's the kind of your lateral lip area, it starts to disappear, starts to resorb over time. And that structure is called the modiolus, and all of your facial muscles on the sides of your face insert onto that structure. And so that's what makes you smile, that's what makes you frown, that makes you shriek or open your mouth, all of these things all pull on that one structure, and so it gets tired. And what happens when it gets tired is that you start to kind of fold in. So the first thing I'm going to do before I put any filler in the actual lip is restore that structure, because it will give her a much more kind of comprehensive approach to her overall mouth restoration and give her a more natural look, because it's not like I'm just restoring the lips without the structures that support the lip. So just by putting a small amount in that lateral area, and also for many of my patients say, turn my frown upside down. Why do I look like I'm frowning all the time when I'm not even sad? And it has to do with restoring that structure right on the lateral aspect of the lip. All right. So again, no filler in the actual lip yet, but you can already tell that you can see more of her lip just by restoring that one area. Okay, so now some filler in the actual lip, tiny little needle, tiny little sticks. And she's not my only lip person today, so if you don't get a chance to see lips now, then you can see them later. Again, just restoring that structure. And you can kind of see I kind of come through. So I really just want you to be able to see a little bit more of the structure. The junction between the skin and the lip effaces over time, and so that's why your lipstick and your lip gloss starts to run up through all those lines. And so just by restoring structure will give you more lip back without volumizing. And I think for many patients, that's what they want. They want their own lips. They don't want someone else's lips. Would you agree? Yes. Yes.
Sure.
Okay, great. You come and ice on this side, Andrea. Okay. There we go. I'm going to just restore that modiolus over here so that she has that support and can see that lateral lip again. You know, a lot of people, it's upsetting when people are really just relaxing and someone asks them, what's wrong? What's wrong? It's like, nothing is wrong. And this can oftentimes correct it. I have some patients that this is one of their favorite treatments, is just treating that modiolus so that they can see their lateral lip again and not look like they're frowning. Let me see, put your Adigun. All right. Some more sticks here. If you have any questions, don't hesitate to send your questions in to DLC. I'm happy to field questions. I love questions. That's the teacher in me. And just restoring structure. Perfect. Now, get the lines in the lower lip. So we're about to move over to another room so you can see how we use filler to restore earlobes. In fact,
Hello, it's me, Leanne again, and I'm here with Diana, and we are going to use Restylane Define to restore some of the maturity-related changes in her earlobes. Now, if you'll notice, over time, her earlobes have become, instead of like a round hole, more like a slant. And so my goal is to gently and naturally restore the volume of the earlobe using Restylane Define. This patient has already been prepped, and I use a tiny, tiny, tiny needle to do this work. Now, she does not have any numb gel on and did not wear any numb gel prior to the procedure. So, Diana, are you ready?
Yeah, I'm ready.
Okay, wonderful. Let's start. So I will first work to restore the bottom of the lobe. Stick here. Just some slow, small injections. And then we'll mold that. So you can see already her ear appears more volumized at the inferior portion. Let's try here next. Stick. Now, if you know me, I do not rush, okay? Never ever do I rush, and so it's a slow, steady process. How's your discomfort level?
No, I don't feel anything.
Okay, wonderful. We'll proceed. Stick here. Just restoring the volume around the ear so that she can wear earrings again.
Yes.
When's the last time you wore any earrings?
Oh, yesterday.
Yesterday. Okay, well, this is going to help them, you know, sit better in your earlobe. Yeah, that looks really beautiful so far. Thank you, Diana. All right, let's give some more structure over here. So I basically inject a small, you know, aliquot of filler and then mold. So already she's looking much more natural. Blot, please. Much more youthful in the earlobe. Stick. And blot, please. Thank you. That's perfect. And blot again, please. Oh my gosh. I mean, we're already doing so incredible. Let's continue to add volume to this second hole here. Are you experiencing any pain?
No.
Wonderful. And stick. Okay, so really with just a very small amount of Restylane Define, we've been able to restore the structure in her ear and give her more support on the bottom so that she can more gracefully wear earrings. And so instead of drooping, they'll stand out. Let's see, I think a little more structure back here would be helpful. Just kind of like in that second hole there. All right, wonderful. Now I'm going to take it back to Dr. Adigun, who is going to fill lips using Restylane Kiss.
Great job, Leanne. Yeah, so I'm actually going to go ahead and finish up lips over here. Go ahead and rest back for me. I'm going to restore kind of her central lip. Okay. Again, small amount of filler is all that's needed. Just gently part your lips for me. Just kind of like rest your mouth open. Yeah, just like that. I think she's had plenty of numb time, which really helps with this discomfort, if there's any at all. Let's restore this structure here. What happens over time, we lose the volume of our lip, as well as the distance between the bottom of our nose and the top of our lip starts to lengthen. And so it just looks like that top lip starts to curl under. Part your lips again for me. I'm just going to go ahead and do a small amount here. I think the trick with lips is just a small amount. And what we'll do is in just a few days, we'll go ahead and post her final pictures. You'll be a little kind of pricked just from all the tiny little sticks, and that causes a little immediate swelling. But that goes down really within just, several hours. So now I was going to, great, this is a great time for questions. Is there any pain after filler? So if we're doing filler in the mid-face, so not in the lips, your face can be a little bit sore over the course of the next several days. You don't feel it unless you are actually touching your face, as in you're washing your face in the evenings or washing your face in the morning. It can be sore to touch. And that doesn't happen with everybody, but it does happen a good bit, and it can last up to a week. In the lips, there really is no pain. You can just be a little bit pricked in those little kind of, almost like if you were to pinch your lips, really actually pinch them, and how they can kind of look a little bit pink and swollen for a short period of time. That's kind of what happens with filler as well. So here I see another question. After treatment, is there any ointment that is needed to go on the pinpoints from the needles to increase healing? And no scarring. So first of all, no scarring from needle sticks at all, even if you were to do nothing at all. The biggest risk from a needle prick really is a bruise. And if we see a bruise developing as we're treating, as I'm doing some treatment, then we actually will offer to laser your bruise before you leave. Because if we use our vascular laser on the bruise, it goes away very, very quickly. Sometimes the bruise isn't developed until the next day. All you do is call the office. We tell you when to come in, and we will laser your bruise all for free. This is our bruise, and we make it go on its way really quickly. We do have a topical treatment made by Elastin that does help bruises go away much, much, much quicker. So that's another treatment that people are really, they really like that treatment a lot. It's a topical agent. We also, for people that have a propensity to bruise, we even have oral arnica that you take a couple of days before your treatment that can also prevent bruising. But no matter what, the bruise is short-lived and the filler is long-lasting. Which brings us on to our next question, which is how long until you see the results of filler? Unlike Botox or Dysport or Jeuveau, those products take about a week to 2 weeks to see full effect. Filler you see immediately. So when I'm treating to correction. That being said, I think after the filler has had a chance to rest in the skin for several days, it really looks best in several days. But then the results themselves, depending on which filler, determines how long they last. So now this is a very exciting time of the hour. Leanne is going to review our first raffle and talk about the treatments that are going to be in the first raffle, as well as the products. So take it away, Leanne.
Hello, thank you so much. So our first raffle is a really incredible raffle for many reasons. It contains some excellent SkinBetter products that I'm here to share with you, as well as a syringe of Juvederm Ultra Plus, which is a hyaluronic acid filler that Dr. Adigun can use in the face, the ears, and then also 50 units of Botox, which if you've had Botox before or you haven't, 50 units is enough to get a great Botox treatment. So this raffle is valued at $1,975, okay? So you want to win this raffle. Let's take a look at some of the products that are included. Okay, so we have an Alpha Red Overnight Cream. Like Dr. Adigun mentioned earlier, this is a great retinol product for people who have sensitive skin. So if you have rosacea, your skin is really reactive, maybe you have atopic dermatitis or eczema, I will absolutely recommend this product for you because it is a mild, gentle retinol that won't have any irritation. So you just put it on at night, you can moisturize first or not, but it is a nighttime only treatment because retinols are inactivated by sunlight. So this is in the basket for SkinBetter giveaway. Also, we have the Interfuse Treatment Eye Cream. Now, the Interfuse Eye Cream is really nice if you have a combination of under eye bags and puffiness plus some sun damage or wrinkles, which are medically called rhytids. So the Interfuse Eye Cream, you just need a tiny smidgen. You swipe under each eye, okay, at nighttime, all the way out to the crow's feet, and you can put it on the top of the lid if you want to, like all the way up to the brow bone. So I really like this eye cream for that combination skin, people just who need a little bit of everything, and I want you to win the raffle. But if you don't, it's 20% off, so that's a great deal. We also have the Even Tone Correcting Serum. So for you people out there who love serums, who love toner, this is for you, okay? This is a very generous 1.7 fluid ounce bottle, and it just helps give you a nice overall even glow. Okay, this sunscreen stick is awesome. I'm gonna open it up. So you just open it up, and you see it's this all mineral stick that you just rub on. So it goes on white but rubs in clear. So this stick is great for kids. It's great for people who don't want to get their hands really dirty by using sunscreen to put. They're using their hands to put on sunscreen. It's a great option just really for anyone, and it blends into all skin types. So this contains zinc and titanium, and it's a really nice option because it blends so well and has that unique stick delivery system. Okay, put this back for that lucky winner. Okay, Jupiter Ultra Plus, a great versatile filler that you can win if you buy one of our products. Remember, all of our products are 20% off, and every product that you buy, you will be entered in to win one of our 5 amazing raffles. Okay, I think we have a question coming in. Let me pause here. How long can you purchase a product? Okay, this is a great question. Anyone who purchased products all this week is entered in to win one of our 5 amazing raffles. So that includes today and tomorrow. So if you've not yet purchased your 20% off skincare products, call us today or tomorrow. You can schedule a pickup that's contact free so that you do not have to get out of your car. We can bring it to you. And so, yes, anything today or tomorrow is entered in to win one of those raffles. Oh, we're going to send it back to Dr. Adigun for some more filler injections. Dr. Adigun, take it away.
Yes, we are back here to do some more lips with Restylane Kiss. If you didn't have a chance to see the lips with the previous patient, I used Restylane Kiss in her as well. Kiss has been a really exciting product for us in dermatology because it has all the characteristics that we really love in filler, and that it really integrates well into the lip tissue. So patients that have it, they don't know they have it, they can't tell they've had it, and it has a nice long duration. Most fillers that we had to use that were safe to use in the lip, that were silky enough and elastic enough in the lip, they just didn't have that staying power. And that's really one of the characteristics that sets Kiss apart, is that it is silky, it is smooth, and it really just imitates lip tissue so incredibly well, and then also has that staying power. Before I get started with Kim, we have another Kim. I'm going to address a question that came in. I think it's a great question, which is, do you need more Botox if you're a man as compared to a woman? So Botox is dosed in units, and that's to soften muscles, most often used in the face, but we do use Botox in multiple areas. And just like muscles elsewhere, although people joke I have big muscles, but men do have bigger muscles in their face, and they do need more Botox. to get the same desired effect? So I think that's a great question. So thank you, Rick, for that great question. So I want to introduce Kim. If you haven't had a chance to meet Kim, she's our newest team member, and she greets you right at the front. She and Oshale run the front like, oh my gosh, they do a phenomenal job at DLC, communicating with patients and helping get your questions answered, and most importantly, get you on the schedule. So meet Kim. Kim has never had filler or Botox before, and I'll be doing filler in her lips. Really what Kim wants are Kim's lips. Those are the lips you should always have, are your own lips. But our lips change over time. Again, I did say that we lose about 50% of our lip over the course of our lifetime. So 50% of the size of your lip, that's a lot of lip lost. And Kim has lost some lip, and she would just like her lip back. Would you say that's right?
Absolutely.
Okay, perfect. And so I'm going to have you go ahead and rest your head against that pillow. Kim has been numbing with the topical numb gel for some time now. She can hardly feel anything. It does take effect very quickly on the lip, which is great because lips are very sensitive. So it's nice if it does. It's nice for it to be very effective in the areas that we're sensitive. We're going to apply a little bit of ice that adds a little bit more kind of cold anesthetic. And then I'm going to clean again. We really more or less triple clean the lip. I am going to spend a little bit of time on the lateral lip here where she's starting to lose a little bit of structure and starting to fold inwards. If I restore that structure, we'll be able to see more of her lip. And I haven't even put any filler in her actual lip. And restoring the structure is also important because if I go and restore the lip, but I don't restore the structure around the lip, it does not give as natural of an outcome. And if anyone knows me well, I want you to look like yourself, the best version of yourself. And so you really need to look naturally like yourself. So just a little bit there. It also helps turn, as you lose that structure, the size of your mouth will curl downwards, which can make you look like you're frowning even when you're perfectly happy. And so it's also nice to restore it to really kind of make it look like you're not frowning, that you just are yourself. So you're going to feel a tiny little stick here. And again, just using a small amount at a time here because she only needs a little bit because we're just restoring what's been lost. Every once in a while, I have a patient that really was hoping to have more volume in their lip, more than they've ever had. And we'll analyze in that circumstance to see if it would be appropriate for that person to have larger lips. Because if it doesn't fit with her overall proportion, then it's really not a good choice. But you can see I'm just restoring structure here. And by restoring structure, she gets a little bit more lip, not with a lot of filler. You're doing great. Here. And she has beautiful shape to begin with. You just have really nice, beautiful shaped lip. And I just want to compliment that. I don't want to change that. Come to the other side. Okay, perfect. I'll be doing more of the same on the side. First, restoring that structure again in the lateral lip, what we call the modiolus. You know, patients will come to me and say, people always think that I'm mad. Why do I look that way? And a lot of times the solution is multifactorial. We may want to address the hyperdynamic muscles between the brows with a little bit of Botox, Dysport, or Jeuveau, and address the volume loss or structure loss in the lip and around the mouth. So how long does lip filler last is another question that came in. I think that's such a great question because a lot of times, you know, this is an investment and you want to know how long your investment will last. It does depend on which filler that we choose to use. I was just reviewing that my favorite filler for lip right now is the Restylane Kiss because I love the properties of Restylane Kiss and I love the staying power. In studies, Restylane Kiss has actually lasted a year, which is longer than any filler that was approved for the lip to have lasted. And so having that staying power is just another added bonus. Look at that beautiful lip. And when I'm treating lips, I'm following the natural anatomic markers. Respecting anatomy is a very important part of getting a beautiful result that matches the face and has respects normal anatomy. Your top lip should always be smaller than your bottom lip. It's actually a 1/3 to 2/3 ratio. When you have, filler in the lips and it makes both lips the same size. They look like hot dog buns. People hear me say this all the time. You should not have hot dog buns for lips. You should have lips for lips, which means we need to respect that normal anatomy. Okay, I'm just do a small amount in her bottom lip, and Kim will actually be done. Beautiful. You did a great job. Just gently part your lips for me. There's a central pillow right here. That's the pout pillow that we lose that over time too. Beautiful. We're finished. How are you doing, Kim?
It was awesome.
Okay, great. So we're going to toss it over to Leanne. She's going to review our upcoming raffles and procedures. Very exciting.
Hello again, it's Leanne, your favorite PA, and welcome back to the Dermatology and Laser Center 4th birthday celebration annual event. So I wanted to first start by reviewing the event voucher. Now, the way the voucher works is that you call and prepay a $250 deposit, which guarantees you those specials that we were offering, 10% off treatment packages, 28% off single treatments until November 13th. And if you purchase an event voucher, it gets you entered into the grand prize. The grand prize is Botox or Dysport for a year. That's right, 4 treatments, Botox or Dysport for a year. I mean, what an incredible prize. Just think about it, if you could have a whole year of treatments on us. We want you to win, so go ahead and purchase an event voucher today if you have not already, or tomorrow, which is the last day to buy the voucher. Now, we're about to introduce Carly, who is doing our Genius Skin Tightening device on the face. Now, the Genius is a radio frequency device that has a gold-tipped tiny needles that stamp into the skin to deliver that radio frequency energy, heating up the skin and tightening the skin, also improving skin quality and texture. So the Genius is a wonderful procedure. You will see it demonstrated, and the patient is also using Pronox, which is our short-acting inhalable laughing gas. Oh, I see the Genius is on the screen now. So you can see Carly, our nurse practitioner. She's my wonderful colleague who I'm so thankful to work with every day. And she is administering the Genius, and you can see her stamping the gold-tip needle into the skin. And Diana is using the Zimmer cooler to help chill the skin after. That's a comfort thing for the patient to kind of stay cool, stay calm. The patient also is using Pronox, which is our short-acting inhalable laughing gas. Pronox only lasts for 5 minutes. So you breathe it in when you need more pain relief, and then you stop when you don't need pain relief. As a result, you can drive yourself home. Oh, and there's Dr. Adigun. So I'm going to let her tell you more about the Genius procedure with Carly. Thanks so much, everyone.
So yes, here we are. We are doing the Genius right now. The Genius is a device, a radio frequency, technically a radio frequency microneedling device. Carly, my nurse practitioner here, who is phenomenal, is actually performing the procedure on Diana Chaik, our newest clinic team member. And for pain management, she's actually using something called Pronox, which is 50% oxygen, 50% nitrous oxide. And Pronox is unique. It's technically analgesia. It is not anesthesia. And what that means is that you cannot use too much of Pronox at any one time. The patient has full control over just how much Pronox that they need, and you cannot use too much. So it's incredibly safe. It's a phenomenal safety profile. And just as important as the safety profile is really its effectiveness. It's incredibly effective at managing any kind of discomfort. So what does the Genius do? So the Genius is the best skin tightening device available. And what it does is it has each applicator, each time that Carly touches the skin with the device, there's a centimeter square that has 49 tiny needles. That hits the term microneedling. And each one of those needles is sheathed in a thermal sheath. So if the needles go into the skin, they don't release any energy until we decide how much energy needs to be released. And so the skin is actually totally protected because those needles go into the skin while they're covered in that special little sheath. So as the doctor or the nurse practitioner or the MIPA, depending on the skin type, determines just how deep we want that needle to go. So we determine the depth of the needle as well as the energy we want to be released by each one of those tiny little needles. And again, it depends on the skin type. It depends on what we are addressing, the problems that we're addressing. One of the most popular areas for the Genius, I would say, are definitely the lower face and the neck. but we can treat all areas of the body, even around the knees, the upper arms, anywhere that we want that skin to be tightened, even around the eyes or other areas that are popular. So again, those needles go in, we determine how deep, the sheaths come off of the needles, and the energy is released. And that energy stimulates remodeling deep in the skin, in the deep dermis, and even down into the subcutaneous fat, depending on where we are. And this has been really a game changer for many patients that were contemplating surgery. They were interested in surgery for addressing some skin redundancy, but they did not want the recovery of surgery from a non-surgical approach would be the genius. And so if you have any questions, please go ahead and send the questions in. And I think one of the biggest questions that I have about Genius is, well, when do I see results? That's a very good question. Final results from Genius are about 3 to 6 months after the procedure is done. And the reason why there is a lag is because we have to let the skin actually remodel after the treatment. So during the treatment, we're releasing energy into the skin that's going to stimulate that collagen building, and collagen building takes time. And so when I talk about Genius with patients, I do explain that a treatment with Genius takes 3 sessions. It takes multiple sessions. And you come in, and if we're treating just the lower face, it's about 45 minutes. We're doing Diana's full face, so that can take about an hour. Would you say about an hour, Carly? 45 minutes to an hour, just kind of depends. So let's see here. Questions. Oh my gosh, multiple questions. Do you have to wait to do this procedure before or after other procedures like BBL? That's actually a really great question. We do this procedure on the same day as other procedures, but I do like to space them out at least on different days if we're talking about BBL. Ideally, we would do your Genius first, wait a week until any kind of post-treatment redness has resolved, and then treat with BBL. BBL is a really wonderful treatment because we can do it either before or after, but what's nice is that it would clean up any residual redness should that arise. Another question is, does this procedure address brown spots? No, it doesn't. Brown spots are in the more superficial layers of the skin, known as the epidermis and the superficial dermis. We get out the Genius when we need to treat tightening. We need to really address tightening of the skin. So high volume, jowl area, laxity, the horizontal lines on the neck, tiny little lines that kind of arise around the eyes and on the forehead. So for brown spots, we have other tools like BBL and Halo, but that's not what the Genius is for. We do apply numb gel. That's the next question. Do you apply numbing cream? And yes, we do. When you come in for Genius, the preparation includes a numb gel that is at least 45 minutes before the treatment. We want you to have it on for 45 minutes before the treatment. The longer you leave numb gel on, the better it works. But keep in mind, the reason why we also use Pronox or some other type of analgesia with Genius is because the needles do need to penetrate the skin, which the numb gel really addresses. But when the energy is released, that's beneath the skin, and the numb gel doesn't manage that. And that's why we like to add on another layer to make sure our patients are totally comfortable. Any other questions? Okay, we'll keep rolling them in. You know, you guys know I love to answer questions. As you can see, Diana is totally comfortable. I will go ahead and answer a common question for Genius, which is, what do you look like after? Right? What is the recovery period for Genius? The first treatment, the recovery tends to be a little bit shorter because of the types of settings that we use for that initial treatment tend to be a little bit less aggressive. And so you're going to be pink for a couple of days. Sometimes you can see some grid marks. By the time we get you to your third treatment, you're going to see tiny, tiny, tiny little grid marks. And those will last about 2 to 3 days at the most. And we just have you stay really kind of well moisturized, and they heal really very quickly. Considering this is a surgical alternative because the results from Genius are permanent, and you only have a few days of redness or grid dots, that's pretty darn good. I think I saw another question, which was, can you do this procedure during pregnancy? We don't recommend this procedure during pregnancy. Your skin is going through so many changes in pregnancy, and pregnancy is such a short duration, even though while you're pregnant, it feels like forever. I know that because I've done it 4 times. It really is a short period of time compared to the rest of your life. And if you know me well enough, I want you to have the best results possible. And considering all the other variables in pregnancy, I recommend it to be done after delivery. We talked about recovery. So there are some other uses for the Genius because of its ability to have such high power and to go so deep. We actually will doing another demonstration with the Genius later today because it is a permanent treatment for what's called hyperhidrosis. So unwanted underarm sweating can be treated permanently with the Genius. So if you feel like you sweat more than you want or sweat more than your deodorant is able to manage or your antiperspirant is able to manage, know that we can permanently treat excessive underarm sweating with the Genius. So what am I holding in my hand? Oh, what is she holding in her mouth? Okay, great question. That is the Pronox. So she is holding it herself because she has full control over managing her discomfort. That is the Pronox. We actually invested in special viral filters for the Pronox. So anything she inhales or exhales, if there is any potential viral pathogens, are actually killed by the Pronox viral filter. What lasers can be used during pregnancy? What a good question. It's pretty unusual for us to use lasers in pregnancy, primarily because, again, you get, if you were getting incredibly red or your brown spots are getting very brown, those are normal changes to the skin during pregnancy. You get increased blood flow, you actually almost double your blood volume, which can make you very red all the time when you're pregnant. And your brown spots all get browner when you're pregnant. That's also normal. And so I don't recommend doing really any of these laser treatments or device-based treatments when you're pregnant because, my goodness, we're going to be able to fix it all after you have the baby. And what is Pronox? So I'll talk about Pronox again. Pronox is a type of pain management device that we have here at DLC that is 50% oxygen, 50% nitrous oxide gas. And unlike the dentist, which is at least 80% nitrous oxide, and you have a mask strapped to your face, you have no control how much nitrous oxide you're getting. With Pronox, you have full control over how much analgesia that you need. So you stay totally conscious, and it wears off in less than 5 minutes after you stop using it. So you can get up, walk out of here, and drive home or go to work one day when we all go to work again. So you really have no residual effects from it for the rest of the day. And what I'm holding in my hand right here is another aspect of managing her pain, which is a cold air blowing. So really, we don't like to feel pain here at DLC, and we do all we can to manage any kind of discomfort at all. So we're going to be heading back to Leanne. This is very exciting. So take it over, Leanne.
Hello again. I just have one thing to add about the Genius for skin tightening. I think it's a really great option for tech neck. So if you like me, spend 4 hours on your phone a day, because we're all addicted to our cell phones, the Genius is a great option to tighten up the skin on the neck from tech neck and those horizontal lines that we're getting as a result of doing this all the time. Also, I can personally attest that I have had Pronox, and I went back to work 5 minutes after I was done using the Pronox for my treatment. So it really helps take all of your anxiety away about procedures, and I highly recommend it if you are at all anxious or nervous. It's a really great option we have. Pronox is an additional fee, but it's totally worth it if you are concerned and need some more anxiety relief. Okay, I want to talk again about our specials. We're offering 20% off products all week. So yes, today and tomorrow, 20% off products. Every product purchase gets you entered into one of our 5 amazing raffles, including the SkinBetter raffle that we've been talking about this hour. Now, next hour, we have some extremely exciting things coming up, so let's talk about it. We have the Elta MD experts coming to talk to us, and so we'll be here answering all your questions about Elta MD products, from sunscreens to moisturizers to body sunscreens to post-procedure products. So we are going to be talking all about Elta MD skincare. Now, Elta MD is probably one of the best-known dermatology brands because it's cosmetically elegant yet economical. So now it's a great time to stock up on your Elta at 20% off. In addition, we are going to be demoing the BBL Hero for improvement of brown spots and redness on the body. One of the best things about the Dermatology and Laser Center and why I love working here with Dr. Adigun, Carly, and our entire team is that it is so important to us to stay up to date. And so the BBL Hero is a brand new advanced technique for treating sun damage, brown spots, and redness on the body. And so I'm really excited that we're going to be demoing that with one of our patients because it's quick, it's not very painful, and it really helps with those body brown spots and redness. We are also going to be talking about Botox for young professionals, that'll be with me, and how we rejuvenate the skin using neuromodulators like Botox. because, you know, you much rather prevent a wrinkle than get one. So my goal is to treat your line before it becomes an etched-in permanent line in the skin, using a neuromodulator like Botox, Dysport, or Jeuveau. And so you'll be able to see my treatment on young professional millennial patient later today. We're also going to be talking about our Color Science skincare product line, and that's one of Dr. Adigun's favorite lines. The Color Science Total Eye is a total cult, has a total cult following because it just really helps with sunscreen and improving under eye circles. Plus, those brushes, I mean, those are amazing, and now is a great time to stock up at 20% off. I think I should buy some, actually, put that on my to-do list. We're also going to be demonstrating the SkinPen microneedling device. Now, I love the SkinPen. It's a great light resurfacing option for the skin, and if you have acne scars, SkinPen is for you. Generally, a SkinPen treatment is about 3 treatments spaced 1 month apart for your optimal results, although I tell some patients who have acne scars to plan for 6 treatments depending on the depth of the scars. Now, the SkinPen, you have about anywhere from 1 to 4 days of redness after, depending on how aggressive the treatment is, that you can wear makeup the next day. And I'm so excited that we're doing that on an acne scar patient today. The great thing about the SkinPen is it can be used on all skin types. Yes, from the fairest to more richly pigmented skin, it can be used on all skin types. Also, we'll be demonstrating our SkinPen today on a skin type 4/5 patient. That's fit fat skin type 4/5, so you can see how that goes. Yes, I love BBL too. Like, that's my favorite treatment to get on myself because it really helps my redness. So completely agree with whoever said they love BBL. And also, I love Elta. One of the great things about Elta is their commitment to innovation. And as you know, I love to stay up to date. It's very important to me to make sure I know the latest research so I can share that with my patients. And so I love Elta because they introduced an all-mineral body sunscreen this year called UV Active. And when I went on my vacation, UV Active is what I wore. Now, because it's all mineral, it takes a little bit more effort to spread. However, it is worth it for that 80 minutes of waterproof resistance. So I definitely recommend checking out the Elta products, which we'll be talking about next hour. And now I'm going to bring it back to Dr. Adigun for question and answer.
Yeah, so I have some more questions that have come in specifically about the Genius. The Genius was a device we were just showing a demonstration of a moment ago, and I want to make sure that we really get all of your questions answered. So let's see here. So how long do the results from Genius last? I love this question because the results from Genius are permanent. Once your body builds that collagen, it's there. Now, the aging process continues. So if you're really wanting to keep up and make sure that this state remains lifted, especially if you are trying to avoid surgery per se, or you just like to make sure that your skin looks good, then yes, you'll want to do it every couple of years. That's typically the routine, is every couple of years to maintain. What other conditions does it treat? I did touch on what's called hyperhidrosis or unwanted sweating. So if you do feel like your underarms sweat more than you would like them to, then we can do Genius, and that is permanent. That is permanent, and with each treatment, it's about a 25 to 30% reduction in overall sweating, and that's permanent. And then we also use it to treat acne scars. So acne scars, especially on the cheeks and the chin, respond beautifully to the Genius. And if you know much about procedural dermatology, acne scars are one of the most challenging conditions that we treat, except for the other most challenging condition that we treat, which are stretch marks. And that is the other indication for the radiofrequency microneedling device Genius that we just demonstrated. Can we use it in all skin types? And the answer is yes. We can use it on more pigmented skin. We can use it on less pigmented skin. We can use it on youthful skin. We can use it on older skin. And that has to do with the safety features of the device and those thermally sheathed needles. So another question that we got is, how else can we manage pain if Pronox is not an option? If you don't feel comfortable using Pronox, what are some other options? And the nice thing is that this is a doctor's office. I am a doctor, and so we can prescribe medications for pain that you would take by mouth as well as the numb gel. And typically speaking, when we're kind of treating to goal or treating to correction on areas of the face or the neck, or laxity of the arms or the knees, I do recommend 3 sessions to comprise 1 treatment. But with the underarms, we do a treatment for the unwanted sweating, and you get about that 25 to 30% reduction. And for many patients, that may be all that they want. If you really want to treat to the point that you have hardly any sweating at all, it may take 2 or 3 treatments. These
So,
questions are coming in. So,
Dr. Adigun, we got a great question about differentiating between the Elta UV Clear and the Color Science Unforgettable. Now,
Yes.
I want to make sure I answer that question fully. So the Elta UV Clear is a great sunscreen if you have oily skin or you're acne prone, and it comes in two versions, a non-tinted and a tinted. I highly recommend the Elta Clear Tinted if you are a person who is in front of a screens all day because it contains iron oxide, which blocks visible light. Now, visible light is extremely damaging to our skin. Actually, 48 hours in front of a screen is like being outside at noon in the peak of the sun with no sunscreen on for 2 hours, okay? And I'm certain that myself, I get 48 hours of screen time a week. So I really like the Elta UV Clear for that, for acne patients, for oily skin patients. And Color Science makes so many wonderful products. You know, that face shield sunscreen with a tiny hint of shimmer, I love. But the Color Science SPF Sunforgettable brush has a different purpose. I like that for reapplication. So you put your Elta Clear on first, and then you use your brush as a touch-up every 2 hours, sooner if you're sweating or swimming. I also love the sun brush for my neck, for my hands when I'm driving. Yeah. I leave it in my car, and so I actually think there's a role for both. Now, Elta UV Clear Tinted or Elastin. This is a trial and error kind of thing. I would recommend that you try both and see if there's a tint that you prefer, if there's a
it's a feel thing too, Leanne. You know, it's really a feel thing. I tell patients, I'm like, you really just need to try a bunch of sunscreens because if you don't love your sunscreen, you won't wear your sunscreen.
Totally.
And it's also possible to love your sunscreen. You can like your sunscreen enough that you want to put it on, that you actually want to put it on, you feel good about it. And so that trial and error, like Leanne said, is really key. We're not going to carry or recommend any products here at DLC that don't totally protect you. And so it's more like a have at it till you find one that you like. We actually do offer 2 different brush formulations. We have the Color Science brush that Leanne talked about that does have a little bit of a hint. It's very subtle, but it's there, of a shimmer, and the Isden brush, which has no shimmer at all. These are also very popular among our tennis players and our golfers that want to make sure that there's no film at all on their hands. So back to the hyperhidrosis, which is the unwanted sweating that we use Genius to treat. A question came in for what other areas can be treated. Can we treat the feet? Can we treat the palms with the Genius? The answer is no, we cannot. Those areas have far too many important nerve endings that we don't want to potentially disrupt that simply do not exist in the underarms. Exactly, in the axillary areas, those little nerve endings aren't there, which allows us to use the Genius there. But we do use Dysport for unwanted sweating on the palms and the soles. So there are still options for people that have unwanted sweating in those areas. Any other questions? Did we get them all answered?
I think we're good for questions now. So we'll be back at 1 o'clock. Join us live at 1. Thank you so much for tuning in. I can't wait to see you in the 1 o'clock hour. Thanks again.
Yes, 1 o'clock. We'll see you then, guys.
Woo!
Oh my God.